But first, police and paramedics in Plymouth are taking part in a pioneering scheme to help people suffering from a mental health crisis, instead of taking them to hospital or even a prison cell.
Yes, the pilot project, the first of its kind in the southwest, involves an emergency response car driving around the city offering support to patients. Well, Sam Blackledge is outside Crown Hill Police Station for us tonight. Sam, this sounds like a very interesting idea.
Yeah, it certainly is. And for years, people with mental health issues would call 999 if they needed it and end up either in hospital or in a police cell. But this new project could start to see an end to that, thanks to collaboration between three very different organisations. Friday night in Plymouth. A call comes in about a potentially serious situation.
1825 receiving.
1825, good evening. I've got a job for you for a 40-year-old male.
A team is sent to check it out. But this is no ordinary emergency response. Police and paramedics are spending more and more time dealing with mental health issues. So a new approach is being tried.
We did some research recently and it showed that one officer was spending 166 hours at the hospital in a 6-week period. A police officer has powers to detain someone that's in a severe mental health crisis for their own safety. So we are limited in what we can do. We do have mental health training, but it's nothing compared to obviously a mental health professional.
And this is where the third member of the team comes in.
I have access to mental health records that I can look up, so I can get there with information which will help us make better decisions and hopefully leave the person at home rather than taking them up to the emergency department or anywhere else.
Last year, a government report called for a fundamental rethink of how and where mentally ill people are treated, saying too often the police are left to pick up the pieces.
It's about listening to people, and because we've got access to information, we know some of people's backstory, because one thing I've learnt over the years is people get very tired of retelling their story, so we can focus on what's happening now and listen to what their concerns are. Sometimes it takes a while because people are very upset, and I think that's the importance of just sometimes sitting and perhaps, giving someone a hug.
The project has also been welcomed by the ambulance service, often the first to respond to someone who may be a danger to themselves or to others.
Taking the patient to an already pressurised emergency department can add to their already low mood and add to their anxiety. This allows us to deliver the necessary care in a timely manner. We can actually manage up to 60% of those patients in their locality or within the public domain.
The Joint Response Team currently works 3 nights a week, and they're hopeful that if the pilot goes well, it may be here to stay.
If we can show the concept, show that it's making a difference for the services, but also the end user, then it would be great to have it as a permanent thing.
Well, as you heard there, the emergency services are really keen on this idea of collaborative working. And this is getting a good response from across the mental health sector too. I've been speaking to the chief executive of the Devon branch of the charity Mind, and she told me it's a really welcome development.
It's fantastic news actually, and for us it's really wonderful to see what organisations will be able to achieve when they work together. We have experienced the pressure that the police in particular are under, and at certain points we have been used in terms as a crisis service. But it's wonderful to see that people will now get care at the first point of access when they need it.
So this pilot stage is very much in the testing stage still. At the end of this, the police will present a business case to try and get funding to make it permanent. They say it's already yielding very good results. They're seeing a drop in the number of people being sectioned under the Mental Health Act, and if this is successful, it could be rolled out across the region.
Sam Blackledge in Plymouth, thank you very much indeed.